demonstrating the use of the Philips OnSite AED. So this is to be used as soon as we get to the patient's side. So the person who was here first wanted to already shake and shout, send somebody, call 911, make sure they're not breathing, begin CPR, send somebody call to get that AED as well. And as soon as we arrive at the patient's side with the AED, we're going to use that as soon as possible. So we'll have that person continue CPR while we open up the AED, minimizing that gap between the last compression and the shock. Then once we get the AED open, we're going to turn it on by just pulling the pull tab here.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
I've got scissors here or inside my first responder kit. In this case, I'll open up my first responder kit because I'm going to need this anyway.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
So I've opened the chest here. I've removed the plastic cover. I'm going to pull this off and take out the pads.
When patient's chest is bare, remove protective cover. Look carefully at the pictures on the white adhesive pads.
Okay, I've got...
Peel one pad from the yellow plastic liner.
I've got a pad on each side of this yellow liner. So I'm going to take off the first pad.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
The upper right chest pad. So I place that. Then
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow. No one should touch the patient.
We'll talk about that at the end.
Analyzing.
Here's where I want to say, everybody stand clear. Analyzing.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now.
I'm going to take one more look head to toe. Everybody clear.
Shock
Delivering
now.
shock.
Press the flashing shock delivered.
At that point, I'm going to see the patient jump just a little bit. As soon as that shock is delivered,
medical services
I want to
have
start
been called.
CPR right
It is
away.
safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
Great thing about the OnSite is I can press this button for help with CPR if I'd like.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
So I'm going to give these compressions at that 100 to 100 compression per minute rate, 2 to 2.4 inches deep. And this is actually giving me that metronome, and it's going to go that 30 compressions to 2 breaths. So at the end of 30 compressions, it's going to have me breathe.
Pinch nose, tilt head, and give 2 full breaths. Breathe.
So I'll give those 2 breaths, and immediately it's going to go right back into CPR for that second cycle. But it's nice to have those voice prompts that kind of talk you through CPR. They're going to talk you through the full 2-minute, 5 cycles of CPR, at which point the AED is going to reanalyze so you can step back, take a look again, and look for any signs of breathing. And then the AED is also going to analyze, and it may then shock again at that point.